Trump Care, the CBO score. The Congressional Budget Office has published a score on the Republican version of Healthcare USA. It is dismal, and you will hear that from the Democrats, Senator Sanders, Senator Schumer, the minority leader of the Senate. So this score on the G.O.P. bill from the House that passed by roughly 3 votes, and we'll do this from a number of angles here. We'll start out with Mother Jones. We'll have the Wall Street Journal and various others. A total of 51 million would be uninsured by 2026. That's compared with 28 million under current law. The CBC projects that 14 million additional people will be uninsured by next year if this dismal bill by the GOP becomes law. The CBC, Congressional Budget Office, predicts a grim market for people who are sicker and who are older. The so-called essential benefits, we'll get into that in a minute, that would lower the average price of premiums but raise out-of-pocket costs. Now, one hypothetical, the CBC anticipates insurance companies might not longer include maternity leave as a basic benefit instead of offering it as a separate add-on cost up to $17,000 a year. Offering benefits and other forms of riders segments people with certain health risks, these pre-existing conditions, from the larger pool, purchasing pool of non-group insurance. That segment causes a small decrease in premiums for a larger pool, but a substantial out-of-pocket increase for those covered. 1/6 of the states would go forward, not just ditching essentials, but also allowing insurance companies to charge higher fees for people with pre-existing conditions. Over time, less healthier people, including those with pre-existing conditions, i.e. diabetes, hypertension, cancer, etc. Less healthy individuals would be unable to purchase comprehensive coverage with premiums close to those under current law and may be unable to purchase coverage at all. That is literally it. Some states used to have a so-called risk pool there. The Republicans tried to sweeten the pot, so to speak, with $8 billion to help sick people obtain coverage, but the CBC says that amount of money is obviously immaterial, no doubt. Now, back to what happened in the House. This is by a paltry margin here. It passed the House 117 to 113. This is no victory for Paul Ryan and his bunch of bandits in the House of Representatives. Now, the House did not score their act. They were in a rush to get it towards the Senate where corrections are. But the problem in the Senate is this. It's all about the votes needed. We'll go to the Wall Street Journal now. This is the voice of business. The headline here, GOP help bill would add 23 million uninsured, cut 119 billion in the deficit through 2016. That is from the CBC. This is by Stephanie Ann Arman and Christina Pearson. The overhaul bill approved by the House would leave 23 million more people uninsured while reducing the cumulative federal deficit by 119 billion. That's over the next decade, 10 years. The reported nonpartisan CBC, and this is again selected by Price himself, the director there. Current Senate talks over its version to repeal Obamacare, the Affordable Care Act. The findings provide ammunition for two factions that the Republican leader needs to pull together. Centrist Republicans concerned about the number of uninsured. Now, if two of these people, so-called centrist Republicans, this is in the Senate, vote against it, he's dead on arrival. It doesn't differ much, but it does differ in terms of the number of people. 24 million people is a lot of people, and there will be more people discouraged. Now, there is a Senate working group, all male, of 13 Republicans, to come up with a proposal that by the August recess. It does not make progress in the coming months. That could forecast trouble. Regardless of any score, it's no secret. See, this is what you hear, that Obamacare is collapsing. It is not, indeed, not collapsing. There are a few little tweaks that could be put to it, and it would move on. Now, found the legislature, CBC, reduced the cumulative deficit by $119 billion roughly over the next decade. In early March, as reported in an earlier version, it would cut the federal deficit by $337 billion over the next decade. Not going to happen. Compared to current law, premiums would increase by an average of about 20% next year and 5% in 19. But in 2020, average premiums would differ based on whether states obtain waivers or don't. And in many of these red states, the prices falling for many consumers. Some would see their premiums reduced up to 30%. In parts of the country through 2026, others would see far smaller drops, and this is one of the problems right there, trying to move this to states. Republicans who criticize the G.O.P. bill, this is a House bill, said that the CBC report reiterates why the House bill came up so short. This bill does not do enough to address Nevada. We talked about that in the budget previous forecast. Medicaid population, protect Nevadans from pre-existing conditions. That is Mr. Heller. Challenges for GOP leaders that any proposal that tempers the House, for example, by delaying or reducing cuts could inspire a vote with conservative Republicans. Now, this is McConnell's situation. Can lose no more than 2 Republicans there. I don't know, and he doesn't know if he has the votes at this particular time. The House bill includes $662 million in tax cuts. That's a joint committee on taxation. Now, these were the 2 people reporting, the joint committee and the Congressional Budget Office. The largest tax cut at $172 billion, that's over a decade, 10 years, would repeal the 3.8 tax on investment income of individuals. That's over $200,000, and married couples $250,000, and they would retroact that back to January the 1st. The report, however, does not back up GOP senators who say the legislation would drive down premium costs for many people who buy insurance on the individual market rather than going through work or a government program. The Senate is likely to face a major battle over how to handle Medicaid. We talked about that in DJ Trump's budget. Politically dicey issues because 20 Republican senators hail from states that expanded Medicaid under Obamacare. Some Republicans are also looking at making the bill's tax credits more generous to older Americans. Now, will this work with the conservatives? This is part of the problem. Discussion suggests that any Senate bill will largely differ significant from what was passed in the House of Representatives. No doubt about that. And we move basically seeing the same thing. Substantial changes will be made. This is from the New York Times. You hear this from various sources. House bill's reduction of $119 over a decade, less than the $150 million projected there. Now, these projections will vary, but you get a map about what Trump Care would do. In 2016, estimated 51 million people under the age of 65 would be uninsured, compared with 28 million who lack insurance that year. That's on the current law. It could perhaps be more. Now, we're talking about in 2026, basically 10 years from now, people that are 55 will, 54 will be there. So this is a very large segment of people. In getting out our progressive opposition to this bill, we have to focus on the people in their 50s and where they will be 10 years from now as far as what is going on here. And they cite a case here, this is the New York Times, Blue Cross and Blue Shield of Kansas City. It's a not-for-profit insurer announced that it would not offer coverage next year. The insurer lost $100 million in 2016 selling individual plans under the current law. It's unsustainable, but again, they were reimbursed for much of this cost. Blue Cross and Blue Shield of Kansas City covers 67,000 people in Kansas City and western Missouri under the federal law. The company departure leaves 25 counties in the red state of Missouri uninsured, period. And Medicaid, which provides coverage to millions of low-income people, would offer tax credits. Now, these tax credits really, from anywhere from $2,000 to $4,000 a year, a family could receive up to $14,000 in a year. The credits would reduce reduced from individuals making more than $75,000 and $150,000 for families. But this is just a drop in the bucket. The ERP and various sub-organizations, older people with lower incomes and net premiums after would be much larger than under current law. For example, a 64-year-old with an average income of $26,500, the net premium in 2026 would be $16,000 a year, compared with $1,700 under the Affordable Care Act, which $1,700 itself is a substantial thing. If you are making $26,000 a year, seniors relying on Social Security or have part-time jobs or have defined pension plans, we're fortunate enough to have those 401ks, etc. The average senior is earning around $20,000, $22,000 there. Now, the House bill, uninsured people would keep, they would otherwise be paid a penalty $38 billion over the next 10 years. It eliminates penalties for large employers who fail to cover their workers. So the government would lose $171 million in premium costs. So this is no walk in the park at all. Let's see if I can get to this. Now, these essential benefits, this is one thing they lead the states on the current law. Insurance coverage in the non-group and small group markets must include 10 major categories. That's what's called essential health benefits. It must be equal to scope of benefits provided on a typical employment-based plan. Each state would use benchmark plans and more insurance plans than non-group and small group people. Now, this is where the devil is in the details, and people will suffer in many, many states. Now, H.R. 1628, that's the House version, a waiver to these essential health benefits beginning in 2020 by submitting their own plans there for health benefits. States could establish alternative requirements in different ways. For example, a state could choose a different set of benefits and benchmarks. So in other words, many things could not be covered, beginning with special enrollment periods in 2018 would require insurers to impose a penalty on people who enroll in insurance plans in the non-group market if they have been uninsured for more than 63 days within the last year. So in other words, there are a lot of things coming here and that we'll see in the ratings. The states varied. That's when the Obamacare was. For example, 18 states mandate maternity coverage in non-group market before 2014. 23 mandate some health care benefits. These are mental health benefits, 7 states prohibit medical underwriting on basic health status. 11 states place limits on medical underwriting. Now, different approaches, different states. What we need to move to is a mandatory national plan on the single payer that all people in the United States would have health care as a right, period, and not as some thrown together scheme where in Mississippi, Alabama, and some of those Confederate states and other states that don't have the money or have Medicaid expansion could come up with all kinds of schemes to deny just basic kinds of things like pre-existing conditions, help screenings, etc. So this is what it is all about here, and we'll start to get more of these details flushed out. Now, the effects here on co-ops and multi-state plans would exempt plans in the consumer-oriented and oriented plans. Those are co-op plans. A lot of co-op plans have bit the dust, and those need to be strengthened also. So these are some of the things, uncertainty surrounding the estimate. Now, they had prior versions. This is 1628. Congressional Budget Office Joint Committee on Taxation endeavored to develop estimates that are in the middle of the distribution of potential outcomes. Such estimates inherently uncertain. There's no doubt about that because, again, they don't have the information. They should get a second score. Increase in long-term direct spending and deficits. It estimates that enacting the legislation would not increase net direct spending or non-budget deficit by more than $5 million in any of the 4 consecutive years. Now, these are some of the things that we're beginning to see. This is from future spending, and again, this is a totally different situation. The Joint Committee, the impact on local and tribal governments, some of the things coming out here. So we'll get more and more of this, and as we move forward, we will, of course, have more information here. Let's do the numbers now from Real Clear, where we are. And the importance here is the overall political environment, not so much where DJ Trump is today. We've set the core at 25 before he is totally out of it. But we do not have to get to base core 25 to say that there are problems. Now, this is from Fox News. This is on Wednesday at 40. From Quinnipiac at 37. From YouGov, that is at 40 there. Rasmussen, who's an outliner here, at 48. Reuters has at 37. Gallup at 39. What this basically means is his support level is gradually dropping by about a point. Now, where he will be in, say, a month from now, we are going towards the end of May and Memorial Day holiday. But when you start talking about this environment, plus the very tenuous situation in the Senate with the House bill and the Republicans coming together, it doesn't bode very well for them. And if we look at these other 2 elections, we had a total meltdown out in Montana. We'll get to that in a minute, where the candidate actually attacked a reporter, claiming the reporter entered his private room, and they got into a scuffle. He broke the man's, this was a Guardian reporter, glasses. So when you get these kinds of situations going on, and in Georgia, also the latest poll, that was by Survey USA, I believe, was ahead out of the margin of error by about 7 points here. This is WXIA TV in Georgia. And we also see now out of Montana. Now, this poll had not seen this before. This is Gravis. This has Gillifort at 49, Turquoise 35, and the Libertarian 8%. He is up, according to this, by 14%. Now, this was on a Monday. We have not seen any other polling out of Montana. A totally different situation. This is Gravis Marketing, a nonpartisan research firm. a 3.4% in it as far as the margin of error is concerned. We are just looking at this right now. Now, this is of likely voters at 45% there, and 13% would, let's see, how likely are you to vote in, this is in the election. 45% said they are very likely, 13% likely, and somewhat likely at 6%, and 36% have already voted, so that was before this came out. Trump's approval rating in this poll is at 50%, disapproval at 42%, and if you weight that, already voted 43%, likely 41, and 50 there. So we're getting a little bit different data here. This is Bullock, approval at 40%, disapproval at 34%. And we won't go into the weighted here. And Tesla at 36%, and his disapproval at 40%. Now, this special election held today. Candidates were Greg Gafante and Queese, and the Libertarian, and there's a Green also in this, Beck and Wicks. Anyway, Gillaforte at 49%, Ron Quest at 35%, Wicks at 8%, and Uncertain at 9%. Now, if we go in to the weighted part of it, already voted at 43%, likely at 39%, somewhat likely there. For Quest, already voted at 41%, have already voted, 33% likely voted. A little hard to judge the turnout here. What's the affiliation in this poll? Democrats were at 26%, Independents are another party at 37%, and so are the Republicans. Now, Latinos, dismal. We don't even have to go into it there. Evangelical Christians, 32%, no affiliation, 26%, 23% are Catholics, and other Protestants, only 1% are Jews, 1% are Muslims. So not there. If we look at the age, high school, 5%, high school graduates, 16%, some college, 30%, 20% of them had bachelor's degrees, 30%, that's a large number, postgraduate or work. Age group, 16% age 18 to 29, 37% were 30 to 49, 32% 50 to 64, and over that 15%. We'll get into the weighted part of it here. And that is basically of their poll, what they see as moving forward. Now, this is Doug Copeland. Anyway, for the Gravis Research, the totals may not round out. There's 818 likely voters in Montana. So once again, before this event where the man imploded, we get to 49% there, 35%. So roughly 15 points ahead of Queese. But let's see, when was this poll actually taken? It was a margin error. Well, landlines, etc. It doesn't say when it was actually taken. It was on the 22nd of March, May, excuse me. So this is when the poll came out here. Now let me just go back over and look at this. Sort of just popped up here. He was up by 14%. Now, has the poll tightened? We don't really know on that one, if it has or it hasn't. But This came out actually on a Monday. Supposedly, I had not seen it. This we saw Alsop's poll. He's up by 7. 14% is quite a bit to be up. We don't know what effects it will have, if any. We'll go ahead now and do the sports, and also what effects this healthcare scoring will have there in Montana, where you have a large amount of seniors, and also you have people that are on Medicaid there in Montana. So we'll just have to see exactly where this is going here. The Cubs did manage to pull it out tonight. The little cubby, Mr. Rizzo, is starting to hit. And we'll go to the NBA first and get the NBA scores straightforward here. And I'm not sure. I haven't had a chance to preview this, if there was anything in NBA at all. And it appears there was not. Oh, wait a minute. This is 23rd. Okay, the next game will be on Thursday. The Cavaliers of Cleveland will be at Boston. Now on to the Major League Baseball. And we'll get these scores in here. Looked at or tuned in to a number of games. The Twins were in Camden Yard. The score there, 4-3 Twins over the Orioles. The Blue Jays were in Milwaukee, 8-4 Toronto over the Brewers. The Marlins were in Oakland. Oakland pulled that game out, 4-1. The White Sox were in Arizona. D-backs 8-6. D-backs are doing very well this year. The Reds were in Cleveland. Cincy 4-3 in that contest. The Royals were in New York and got shut out by the Yankees. 3-zip. The Mariners were in D.C. Nationals are 5-1. Dr. Bernanke is happy. The Rockies were in Philadelphia. Rockies 7-2. Rockies are doing very well also. The Rangers were in Boston, and Red Sox 9-4 in that contest. The Padres were in New York. Padres 6-5. The Angels were in Florida. Rays 5-2. And in 10, the Pirates were in Atlanta. 12-5 was the score. Pirates there. They had 14 hits, 1 error, and the Atlanta team 12 hits and 1 error. The Giants and Cubs in Wrigley Field. Mr. Kendrick was the winner there, and 5-4. The Cubs pulled it out to save Wade Davis. The Tigers and Astros in Houston. Tigers 6-3. And finally, the Cards out in Los Angeles. The Cards win this one 6-1 over the Dodgers. Leakey was the winner, and Mr. Hill was the loser in that contest. On we go to the National Hockey League. I had not looked at this one either to see where they are in their Western and Eastern Conference playoffs. That will, I guess, game 7 will be, when is it? Tonight. Yeah, it'll be tonight in Pittsburgh. And they were off. So this is the stratagem of playoffs. Let me get to this Montana thing as we close out here. This is by the Bozeman Chronicle. Reporter alleges Greg Gilafante body slammed him in Bozeman. That's evidently where Gelafante's office is. We'll see if we get the latest on this. Oh, so he's actually been charged. Oh boy. Late on the night before a hotly contest election today, Greg Gilafante was charged with a misdemeanor assault after a national reporter alleged the Republican body slammed him, sending last-minute shocks through the race. Shortly after 5 p.m., the Gallatin County Sheriff's was summoned to Gelafonte's headquarters in Bozeman. The reporter Ben Jacobs of The Guardian. He was body slammed after multiple interviews with witnesses. Wednesday night, the sheriff's office cited Gelafonte for a misdemeanor. Gelafonte said the incident did not meet the criteria of the sheriff, Gotkin, of a felony, must appear in court in June. And the interview, we alluded to that. The glasses were broken there. The Fox crew was in the room, posted their account on their website, which contradicts the campaign statement. Now, this is from Fox News. Gelafonte grabbed Jacobs by the neck with both hands, slammed him into the ground behind him. I watched in disbelief as Gelafonte then began punching the man as he moved on top of the reporter and began yelling something to the effect, "I'm sick and tired of this." Fox News reporter wrote in the story. Jacobs was evaluated in a medical ambulance and taken to Bozeman Health Deaconess Hospital. That's according to the emergency responders. He left the hospital at 7:25 in a sheriff's vehicle and was wearing a sling around his arm. He's going to sue Gelafonte for this. Headquarters, and was speaking with deputies. Medical responders provided initial care aid. The sheriff added his office retrieved the audio recording from Jacobs and was in contact with the Gallatin County Attorney Marty Lambert. They didn't file him at the scene because they, I guess, were moving on the investigation. Now, the Fox, Christy Mary out in Montana for bringing this initially up, so we'd have this information, and on to Bozeman. Gelafonte, this character here. Fox News team witnesses a candidate body slam. We'll put this on some Twitter feeds here and up on the Facebook. And this is a report, a special report with Brad Beyer, I suppose. Anyway, an interview with two candidates. They had the producer there, Faith Manigan, and the photographer there in Bozeman arrived to set up for the interview. This is the Fox people, where a volunteer barbecue was taking place. And what happened there, they were interviewing Gelafonte on the scoring that we're reporting on tonight. And Jacobs scrambled to his knees and said something about his glasses being broken. He had faith in keeping myself for our names. In shock, we didn't answer. Jacobs then said he wanted the police called and went to leave. So this was the information from the Fox crew. For myself and my crew, we are cooperating with the local authorities now. The misdemeanor citation moved forward here in the last days. Now, people obviously have already voted in this election. What effect it would have, that effect we'll probably will obviously not see, but to the people going to the polls, that will depend a lot on how the turnout materializes. It's difficult when you're dealing in the last day of an election. This morning, of course, in Montana, but you do have the day going forward here. I'm not certain what time the polls close in Montana, but we'll have to see on that one as to where this story will ultimately, as they say, end up. But it is a crushing story. The breaking in the Bozeman Chronicle. This is where He is headquartered, Gianforte, charged with election eve assault. Evidently, this guy has a history of doing strange things to many, many people. Let's look at the campaign spending while we're here. We'll not have an idea. We did something on this. Surged to $17 million has flowed into the race to replace Zinke. $9 million from the campaigns. Gianforte has raised $10 million. Well, the two candidates combined. Outside groups have spent $7.1 million. The Quist campaign announced that it had topped $6 million in contributions, noting that it generated $1 million from small donations the past 5 days. And of course, Bernie was there over the weekend. The Gianforte campaign has raised $4.6 million, including a last-minute loan from him. This guy's a multi-millionaire. $500,000 he lent the campaign, $1 million there. So in other words, a lot of money has come in. Weeks of Libertarian about 2,000. I'm sorry. And there is, I guess, a Green candidate also in this race. So we'll be looking there. And what else do we have? There was one other item we wanted to get. This is from a Bozeman paper. Healthcare is a key issue in Montana. This was on the 23rd. No doubt there. The median annual income is $38,000, about 25% below the national average. 20% of this is in a town here. I'm not sure where this is, but anyway, excuse me, is sort of it. Despite all their protests, one of 8 in Mayor County, I think, is newly enrolled in a Medicaid. So Quest is running there. He supports a single payer, as such as Medicaid for all there. And what they did in this campaign was made lots of little problems that Quist had, defaulting on a $10,000 loan that he later paid back. This is on this botched gallbladder operation that he had, period. Now, the state has 77,000 new enrollees on a Medicaid, a vast amount of people. And, of course, we've already had the scoring there. And in White Sulphur Plains, with somebody named Carol Berg voted for Trump in the fall. But like many of us, she doesn't mind saying the current law is a lifeline. Well, we'll see if she votes on the current law or not. On the unemployment in White Sulphur is at 4%, famous for its own mineral spas. It's a 90-minute drive east of Helena. I don't know where it is. I'd have to ask Mary about this. She would definitely know. This will do it for us, and we have about 6-7 minutes of a press conference by Senator Schumer, Senator Murray of Washington State, and of course our own Bernie Sanders coming up here. We'll see you on the next forecast on the next broadcast, and we're working on our open source report from WBRN Radio in Boston and on the Boston Red Network.
Trump care would be a cancer on the American healthcare system, causing costs to skyrocket, making coverage unaffordable for those with pre-existing conditions and many seniors, and kicking millions off their health insurance. Unless you're a healthy millionaire, Trump care is a nightmare. This report ought to be the final nail in the coffin of the Republican effort to sabotage our health care system. Republicans in Washington and the President should read this report cover to cover, throw their bill in the trash can, and begin working with Democrats on a real plan to lower costs for the American people. There's a lot to unpack in the report. I'll just focus on a few provisions. First, costs. CBO report makes clear your premiums are heading up for the next several years if Trump Care passes. 20% increases in 2018, 5% following year. Now, Republicans are crowing about premiums going down in the outer years. That's because the coverage is so bad. Of course the premiums go down, but you get almost no coverage. Cheaper insurance isn't going to help anyone if it doesn't actually cover you when you're ill. If you're an older American, Trump Care is going to force you to pinch your pennies just to be able to afford health care at all. The CBO report says that seniors could see their premiums go up by as much as 800% under this bill. Pre-existing conditions. The CBO report states, a direct quote, this is from the Tom Price selected CBO director, people who are less healthy would ultimately be unable to purchase comprehensive non-group health insurance at premiums comparable to those under current law if they could
already knew about Trump Care, and it confirms the worst fears of families across the country. Under Trump Care, if you're one of the hundreds of millions of people in the United States who has a pre-existing condition, or if you're a woman, your health care costs could go up dramatically. If you are on Medicaid, you could lose that coverage along with tens of millions of other people. If you are a Planned Parenthood patient, you are very likely going to lose your provider, the one you trust, because of politicians in Washington, D.C. But if you're a big healthcare corporation, odds are good you're going to look at a massive tax break. And of course, if you are President Trump, this is just one huge win just for you. Now, Senator McConnell said this morning the CBO score would, quote, repeat things we already knew about the House bill. That is completely true. But let's be very clear. The principles behind Trump Care in the House and Trump Care in the all-male, closed-door Senate Republican working group are the same. That it's fine for sick people and seniors to pay more for worse coverage, that insurance companies should be able to sell people insurance that's no better than snake oil, and that if people nationwide lose coverage altogether, it's somehow no problem. So as long as the wealthiest get their tax breaks and President Trump gets his partisan political win, they're fine. Those are the principles families are rejecting. Those are the principles Democrats here today are rejecting. And Senate Republicans should know until they do us well by dropping repeal and their partisan efforts to sabotage the healthcare system in ways that hurts families and raises their costs, they are standing squarely in the way of real solutions to problems far too many people across the country are facing when it comes to their health care. I hope the Republicans take a hard look at the facts today and change course. And if they do, I know that as Democrats, we are ready to get to work to make health care more affordable, get more people covered, and help them get higher quality care. That's the goals we should be working on. Senator Wyden.
Thank you, Senator Murray, and on the House bill and pass it. Gives us a big
the health care that they currently $1 billion denying health insurance
out, and we're going to make sure that all of America understands over the next 10 days that if the Senate Republicans come back, try to put a cosmetic change or two on it, and then, as Senator Murray points out, fast track it through the Senate, we're going to be stopping it cold. And certainly the CBO information gives us a big boost. And Senator Sanders is next.
Thanks, Ryan. We can call this legislation whatever we want. You can call it a destroy health care bill. You could call it a tax break for the rich bill, but we should not call it a health care bill, because I have never seen a health care bill which throws 23 million Americans off of health insurance. That's not a health care bill. It's not a health care bill when you cut Medicaid by $800 billion, denying health insurance to children or some of the poorest people in this country or middle-class people who need help with nursing home care for their parents. It is not a health care bill when you defund Planned Parenthood and deny 2.5 million women their choice of health care providers. It is not a health care bill when you force older workers to pay 2, 3, 4 times more for the health care that they currently get. So call it whatever you want, but please do not call this bill a health care bill. This is legislation that provides over $200 billion in tax breaks to the wealthiest 2%. It is legislation which provides hundreds of billions of dollars in tax breaks for the insurance companies, the drug companies, and other people in the medical industry. Our job is to come together and improve the Affordable Care Act. That means lower deductibles, lower co-payments, lower prescription drug costs. Our job is to pass a health care bill, not to throw millions of people off of the health insurance they currently have. Senator Blumenthal.
Thank you. Thank you all.